Pallister-Killian Mosaic Syndrome by Julie Burleson. Pallister-Killian Mosaic Syndrome is a very rare chromosomal disorder that is caused by having at least 4 copies of the short arm of the chromosome 12 instead of the normal 2. PKS is a relatively new syndrome. It was first discovered in 1977 by Philip Pallister and then again in 1981 by Maria Tressler-Nicola and Wolfgang Killian. There is a small number of children born with this condition listed in medical literature, around 200, making full understanding and resources difficult. The syndrome affects males and females equally and may go underdiagnosed because it is difficult to detect patients with mild symptoms. PKS is not inherited. It is simply caused by a random event during formation of reproductive cells. Pallister-Killian Mosaic Syndrome should be the most important chromosomal disorder being studied today because of its rarity and there not being many resources for families of children with PKS. The isochromosome 12 can primarily be detected in samples of skin fibroblasts, as well as chronic villus and amniotic fluid cell samples. Very rarely, it can be detected in blood lymphocytes. It is also possible to detect the isochromosome in circulating lymphocytes as well as other amniotic and placental samples. There is no strict limit as to where the isochromosome can be found. However, it's unlikely that these samples will be tested if the blood karyotype is normal. Pallister-Killian may be diagnosed through ultrasound, through observation of hypertelorism, which is a broad neck, short limbs, abnormal hands or feet, a hernia of the diaphragm, and increased amniotic fluid. Once born, a child may be diagnosed by observation of the syndrome's distinct facial features. Skin cells are taken from inside the cheek and sent for karyotyping. Signs and symptoms of PKS range from mild to severe or even profound. During pregnancy, the mother may have a large amount of amniotic fluid and deliver early, but the baby may be large for its gestational age. APGAR scores will be low, and the baby may have to stay in the NICU, the neonatal intensive care unit, for extended periods, from anywhere from 2 weeks up to several months. A minority of babies will have severe acid reflux, resulting in the need for a nasogastric tube or a GJ tube for feedings later because the suckling reflex has not been developed. A handful of infants will need a tracheostomy to help with their breathing. Physical traits of Pallister-Killian Mosaic Syndrome consist of coarse facial features such as high forehead, abnormally wide space between the eyes, broad nasal bridge, highly arched palate, fold of skin over inner corners of eyes, sparse hair on the head, large ears with thick lobes that protrude outward. Babies born with severe low muscle tone can have problems with feeding, breathing, walking, and standing. 70% of patients will not walk without assistance. Symptoms vary according to which tissue have the additional chromosomal material, and the body may be affected unevenly. PKS patients can have congenital heart defects, stenosis of the auditory canals, abnormal opening of the anus, hypoplastic lung, abnormalities of the genitourinary system, and skeletal malformations. Seizures and epilepsy are seen in children with PKS. Having an extra finger or toe or even extra nipples is not uncommon. Skin discoloration is very common as well. Some children will have the absence of sweating and decreased renal function. The anus and vagina may be close together in girls and will need surgery for correction. Boys' testes may not descend. Sometimes children with PKS will develop scoliosis. Children may also have lack of eye contact, astigmatism, spinal bifida, brain atrophy, and a degree of deformation in the ankles and feet. Here's a picture of a patient with PKS who has a couple extra nipples under her left arm. Behavior of patients with PKS tend to be very placid. They do not interact that much with their surroundings. Some are sociable, some a little more than others, and may interact with familiar faces or voices. Most like to be left alone. They behave like children younger than themselves. Most, if not all, will need to attend special schools and will need lots of assistance with their ADLs, which is their activity for daily living, such as bathing themselves, dressing themselves, and feeding themselves. Currently, there is no cure for Pallister-Killian mosaic syndrome. There's no specific therapies identified, as each patient has to be treated individually. The goal is for each patient to live as normal a life as possible and to their fullest potential, whatever that may be. Surgery may be needed to address heart defects and hernias or bone malformations. Respiratory and breathing support, such as a tracheostomy or supplemental oxygen, may be needed. Physical, occupational, and recreational therapies to build muscle tone and motor skills. Enrollment in early intervention programs to address developmental delays, intellectual differences, and communication issues are imperative. Assisted communication devices and the training of sign language may be needed. Bracing, casting, and surgery for bone issues. The prognosis for patients with PKS is not well known. What we do know is that most will need lifelong care. They will need lots of support from their family. Some babies face life-threatening birth defects in infancy and may not survive into early childhood. A small amount of patients with the mildest form may be able to live on their own. The oldest known patient is 45 years of age. Few resources are known for patients with PKS. Most all are online resources, and I have made a list of those here for you to look at to get support and further information. In conclusion, Pallister-Killian mosaic syndrome is a very rare chromosomal disorder. Knowledge is just waiting to be discovered. The effects can be mild to profound. There's very little support and resources available. Studies and more research needs to be done daily so we can train pediatricians and other specialists more to be able to provide more support to patients with PKS. And the more research there is, the brighter the futures for all who have this disorder or any other disease or disorder.